What is cervix? Cervix is the lowermost part of the uterus, female body. Any changes in these tissues may present as dysplasia first and then it may progress to cancer. The cause of cervical cancer is a virus which is known as the human papilloma virus. This viral infection is present in all women who are sexually active. This viral infection can be asymptomatic and sometimes it has long latent period, and over a course of months and years it may progress to cervical cancer. Who may be sexually promiscuous at a very early age and with low socioeconomic conditions, with low hygiene conditions, may have the risk factor of getting cervical cancer. The signs and symptoms are very subtle in an early stage because there may be a change in bleeding. Even after the normal menstrual cycles, there may be bleeding. There may be a post-intercourse or post-coital bleeding, which is an important sign, and foul-smelling discharge. This may be also a sign of cervical cancer, and sometimes there may be a subtle or lower backache, which may be present for over a period of months, and this may be also an important sign where you need to get diagnosed. Coming to the most important question, can we screen it? Yes. Hearing of a test known as pap smear and another test, HPV test. Now this pap smear is the collection of cells from the cervix which may be done at yearly or annually or 3-yearly intervals for women more than 21 years of age group who are sexually active, and these cells can be studied under the microscope to see the changes which have happened. Since it is a spectrum of changes, so we can study if the cells are dysplastic or if the cells are outrightly malignant. So the guidelines are from the age of 21 years, every 3 years, up to the age of 30 years, we can undergo pap smear, which is easily done as an OPD test. It's a painless test. Any woman can come down and get a pap smear done. From the age of 30 years, HPV co-testing is also recommended. We also do the human papilloma virus test with pap smear test so that we can know who are the at-risk factors of getting cervical cancer. Mostly in my OPDs, when we see patients, the most common question a person asks is, can any cancer be prevented? For cervical cancer, yes. Prevention is possible because we have a vaccination program which can be done for young girls from the age of 11 years onwards, where 2 doses of the vaccine can be given. But it is very important, before the first sexual intercourse, the vaccination should be done so that the immunity is developed. After sexual intercourse, it may not be that successful, but before, if the vaccination is done before the age of 11 years, we can prevent cervical cancer.